Good morning. This is Daybreak, and thank you for staying with us. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. In the course of this broadcast, we'll sample your feedback here on Daybreak. On my immediate right is Robert Pukosa. He is the chair of the National Assembly's Health Committee, as well as the lawmaker representing Endebess constituency in the county of Trans Nzoia. Good morning.
Good morning.
Thank you for your time.
Thanks.
Next to him is Peterson Wachira. He is the chairperson of the Kenya Union of Clinical Officers. Thank you for your time. Dr. James Nyikal is the lawmaker representing Seme constituency from the county of Kisumu. Thank you, Dr.
Thank you.
As well as Dr. Davji Atela, who is the Secretary General of the Kenya Medical Practitioners and Dentists Union, joining us from Sydney in Australia. Good morning, Davji.
Good morning, Kadir.
Let's begin with this very important aspect of what featured in the President's manifesto, dubbed the plan, when he sought the mandate of the Kenyan people. And there are bills that are before Parliament meant to drive the country towards universal health care coverage. And this includes the radical proposals that are contained in the health bills. The mandatory registration of all Kenyans for the Social Insurance Health Fund, that is SHIF, and Kenyans not registered for this will be denied public services in the national and county government institutions according to the proposals. Children to be registered at birth, and this is just one of the 4 bills that Parliament will be debating, and subsequent passage or rejection to that effect of the proposals contained following the approval given to that by the Cabinet. I first begin with you, Dr. James Nyikal. Is this the path towards the attainment of universal health care? When you look at the bills, I'm sure you must have perused or skimmed through the contents of the bills or the proposals. Does it reflect in any way the drive towards universal health care coverage?
Yeah, let me start by also letting you know that I'm also a member of the Health Committee.
Okay.
Yes. Yeah.
Good to know that.
Yes. In principle, yes. And often we do many things, and in principle, they're right. What normally matters is when you come to the implementation. Like you're saying, all will be members when they're paid up. Of course, you'll remember that there are people who are not able to pay, indigents, as they are called them. They can't pay because they are not able to. And so those have to be taken care of. The proposal we have there is that they will be paid for by the government. Yeah. Now, that's where you start. If we say that and we don't do it, then obviously that will not work. The bill also proposes other funds, although they're within the same board, and that is a primary health care fund, and also critical care and chronic illness, critical care, emergency and chronic illness fund. That is also within. Now, again, those are to be primarily funded through tax, the two funds. Then the contributory one is that. So if those two are not funded, it's a good thing, but will they work? Particularly critical care, emergency and chronic illness, particularly emergency care. People find themselves going into places they didn't want to be taken to because they were not prepared, and they have to be taken care of. The providers, the facilities will spend money, and quite often in the past, they have had a problem who will pay. Because it's an emergency. If this fund is in place, it will pay. So in principle, that is right. Now, shall we get the money into the fund? As a committee, we said, yes, that's a good thing. And we will pass it. It will go to the executive. Will the money be there? We say the primary health care fund also should be funded through the tax. Will the money be there? There's even a proposal that those who may be able to pay but cannot immediately, some fund will be made available for them so that they can sort of borrow and pay. Will that be done? So the path, in many cases, looks right. But do we walk the path?
Okay, so the question is about implementability.
That is the biggest problem.
And putting into action the proposals, if say, for example, the House passes that bill. Peterson Wachira, do the proposals in you as the lead of clinical officers in the country instill hope in you to address the very grim realities that today dot the healthcare system in Kenya?
Thank you. I would say partly yes, because I think we have very bold provisions, and some of which we have actually been advocating for, like the emergency fund, the critical and chronic diseases fund. That is something that we have been advocating for, and in the spirit of UHC, the prevention from catastrophic financial damages to the families. And that means that most families are not going to become poor because probably there is a chronic or critical illness that they are suffering. But I want to agree with Mheshimiwa here that our problem really is in implementation.
Okay.
Rwanda took our blueprint on UHC and they have been implemented. I think they are ahead of us on the same. And we have even seen some of our county governments even going there to benchmark, and probably other countries. But now, coming to the specific bills, we have probably issues of concern that we would like looked into. Because even as we try to probably provide for some of the interventions that we think are going to assist, and the shift to the primary health care, the paradigm shift from the curative, not necessarily from the curative, but now giving the prevention bit, the primary health care promotion prevention, that priority, I think will be a game changer, because we are reducing the overall cost of delivering that health service to the Kenyan. But as we do that, and as we give this role to community health promoters, who are very good, by the way, and they are critical, we must also be very cautious on what we allow them to do, because what we have had and what we have seen in the bill, some of the things may be misconstrued and probably even give them responsibilities that are beyond their competence and their knowledge and their training. Because basically these are people who have not been trained medically. They are people who there is no threshold on the health knowledge they should have. But then when we say that they should be able to provide first aid and treatment of minor diseases and injuries, that is so ambiguous. And the interpretation of that may be misconstrued. And that may mean even themselves probably carrying some antibiotics and what have you in the village and dispensing, which may be a catastrophe in terms of antimicrobial resistance. So we have we submitted, because the Ministry of Health called us to give memorandums and even to present orally, and we were able to highlight these issues. And we hope, we have not seen whatever the ministry presented to Mheshimiwa in Parliament, which we would be hoping to see, so that we see if probably they took into consideration what we presented, so that then we can also present before Parliament and try to convince them that some of the things there, they need to be really defined to ensure that we stick to the confines of the competence of the CHPs.
Honorable Robert Pukose, the Primary Healthcare Bill 2023, the Digital Health Bill, the same year Facility Improvement Financing Bill, the introduction in Parliament and the content therein. I mean, is there enough awareness around this, besides the much hyped 2.75% deductions? What are the other issues and the components that the Kenyan people ought to know in this drive that the government says will achieve universal health care in Kenya?
Thank you for inviting me to this talk show. First, I want to wish my people of Endebess who had come to Nairobi to appear before the dialogue committee and they were injured on their way back through a road accident, quick recovery. I want to thank the Moi teaching and referral staff for having attended to them, and all of them are doing well now. Coming back to issues which you've raised, first and foremost, the issue about the 2.75%, it's not appearing anywhere in the bill. I've seen people talk about it, but it's not appearing anywhere in the bills that have been submitted to Parliament.
Mm-hmm. So you mean there are no deductions?
This bill does not deal with deductions.
Okay.
These bills, and I think that is where the problem is. People are hyping. I think Kenyans need to be able to read the bill and understand what is in the bill instead of talking out of rumors and innuendos, because there's nowhere in that bill where it talks about deductions of 2.75%.
You mean all the bills?
Yes.
Okay.
Yeah.
So what will be the deduction formula?
The deductions, those will be based on the regulations that will be done by the ministry. So what is going to happen is that once the bill is passed, the ministry will do regulations. And in those regulations, they'll provide for what is the percentage in terms of contribution. What is it that the government is going to give? And then from there, that is now, when you do those regulations, you'll subject it to the public participation. Then the people will decide. So you'll have arguments for and pro, and what is it? What is the best way for us to do the funding? In these bills that are before my committee, we have the Social Health Insurance Fund bill, and we have the Digital Health bill. Those ones are the ones now which, after public participation, we submitted them to Parliament, and yesterday we debated for the second reading for the two bills. And hopefully, if the House Business Committee prioritizes them, then this afternoon it will come for the Committee of the Whole House so that amendments can be now be discussed. These bills, when you look at them, basically, then the other two bills, the FIF bill and the primary health care bill, those are now before the Senate. So the Senate are the ones who are prosecuting it, and I think they were doing public participation in Lodwar yesterday. Okay. So these bills, when they appear before the House, as it is now, when you look at the primary, in terms of the Social Health Insurance Fund, which my colleague, Dr. Nyikal, has told you, it has three funds. It has the Social Health Insurance Fund, it has the Critical, Emergency, and Chronic Diseases Fund, and it has the Primary Health Care Fund. When we talk of the Primary Health Care Fund, this is where it is looking at level 1, level 2, and level 3. Dispensary, health center, and community prevention. That's where we're talking about. And as Wachira puts it here about complaints in terms of that we don't know whether these community health promoters will now start using even antibiotics and whatever. The kit which they are supplied, it has no antibiotics. Because I was there the other day at Uhuru Park when the president launched the distribution of these kits to the 100,000 community health promoters. The only thing it has is it has the deworming tablets for common worms, which can always be dispensed by somebody with a little knowledge. Okay, and medicine, actually, I'm a doctor by profession. I'm a consultant general surgeon. My colleague, Dr. Nyikal, is a pediatrician and is a neonatologist. Okay. Within the committee, we have even Professor Kuya Jaldes, who is a gynecologist. Okay. We have a dentist, member for Nyeri Town. Okay. So we have public health consultants within the team. Okay. So the issue about whether, we as doctors also, we are able to discern what is it that somebody at the primary health care can be able to do.
Thank you. Okay. Okay. The aspect of regulation is what Peterson Wachira had pointed out, and now that is clear, we'll talk more about the regulations and of course some of the proposals that might come from the ministry itself, which can be higher or lower than the much talked about 2.75% deductions. Dr. Adavji, good afternoon, and thanks for joining us from Sydney in Australia. The bad news is that we often have these policies on paper, but there is doubt over the implementation matrix. I mean, how do you think then the government can embark on this journey from early stage to attain what would be, if implemented, would become the game changer in the country's healthcare system?
Thank you, Abdikadir. You know, when you come to talk about the universal health care or the attainment of it, first of all, we look at when was it first launched in the country. It was in 2017, and there was a plan to have it, the access of universal health care by 2022. And you can see we are going again to a phase of a relaunch. So based on the piloting that was done, based on the launching that was done again in 2022, and the current launch that is being done, I can confidently say that universal health coverage that is being done is actually a pipe dream. It may not be realized anytime soon. But when you go back to this, because the reason why I'm saying that, because there are two very important components of the universal health care that has to be considered. One is access to quality health care, and second thing is that it should not, when you are accessing this care, it should not consume more than 10% of your income. But if you know in our country right now, accessing care is actually a mayhem. And as we focus on that, you'll go to any of the public facilities in the country and would have that access to care. Let me go to these bills. The one thing that actually is good about these bills is this part of the emergency fund and the chronic fund. Because we know a lot of times there's been detention of patients, particularly in the private hospitals. And this happens because when they visit the public facilities that we have in the country, they don't access the care. So most of them end up in the private hospitals, which they get detained. Probably if this emergency fund is implemented, it may actually help that, because then they will be able to get paid for these particular their bills. The other thing that we're looking at is this SHI fund, the Social Health Insurance Fund. We know that the out-of-pocket expenditure for Kenyans is very high. This SHI, the Social Health Insurance Fund, is removing what has been achieved by NHIF, which you call the comprehensive medical cover component of it, which in essence, it means that you will have probably to go to, I believe, public hospitals. So if they are dysfunctional, it then means that you still have a higher expenditure from your out-of-pocket. Because as we know in this country, based on the strikes that you are seeing, the counties are not employing health workers. The health workers, the hospitals do not have drugs. The hospitals do not have equipment. So in this narrative of universal health care, it becomes just a political rhetoric. And it becomes just a thing that is put in policy and in documents without a clear plan of its implementation. Okay. I know there is this aspect of FIF that is coming up, or Facility Improvement Fund, which in essence is very good. But we must know that in the structure that we have healthcare currently, where we have 48 governments implementing it, we have 47 counties and the national, it's a matter of rhetoric in many situations. And even the way it's being provided in different parts of the country is more subjective to the person in the office. And more funds will be directed to other developments than actual healthcare. Okay. So we have to really look at that when we are preaching the aspects of the universal healthcare. We have to see what have we done with the budgets of over 150 billion that has been put in the universal healthcare before. And what are we going to do in this differently in this dispensation?
Thank you. And we'll talk about the finances and some of the and the point of convergence between the national and the county governments, and flesh out some of the standing out issues in the bills that have been proposed and are before the National Assembly and the Senate, the bicameral House, and focus on also the welfare of the healthcare workers and what has been very critical for healthcare workers in Kenya, the formation of the Health Service Commission, which they said, if formed, would have centralized the welfare system of the medical professionals in the country. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. We will sample some of your feedback here on the course of this broadcast. Stay tuned.